Hi everyone, I'm Dr. Kenny. I'm from Malaysia, Sarawak, Borneo Island. So I'm a medical director and also a chief operating officer running a medical center in the second city of Sarawak, a part of Borneo, for the past 4 years. So first of all, I would like to thank Health 2.0 for inviting me, recognizing the effort of our team as leaders in this field to ensure that healthcare is accessible and also available in our local community. So what we do in Sarawak is we are the only healthcare provider for local group of doctors. They actually initiated a chain of hospitals throughout Sarawak and going towards Sabah. And our aim is to ensure that services is available at doorsteps. Make sure it's available and also is accessible for universal coverage. We find a lot of methods to ensure services, especially emergency services, cardiac, neuro, is accessible through fundings in a prospective payment method, full fund method, that we collaborated with a lot of agencies, stakeholders such as governments, companies, NGOs, and our aim is to grow together with the city. So I'm very thankful to Health 2.0 for this chance to bring me to this landscape to showcase how great Sarawak is, that we are not just a place of nature and healing, we are also a place of innovation. So thank you very much.